Let me show you what I'm going to be talking about. All right, so I'm going to be talking about the content and format of the NPTE and how the questions are formatted. I'm going to be talking about developing a study plan. I'm going to talk about best practices for studying, like how do we learn best? How do you review all this material? What critical reasoning should you make sure that you're working on when you're studying? I will talk a little bit about Therapy Ed's materials, and if you're using those, how to use those. And then some test taking tips, analyzing your practice exam results, and then tips for managing anxiety. So based on this, like what's the thing that like you're most interested in? So I just give me an idea, maybe a little bit about where to spend my time. So what are you like? Oh yeah, I really need to hear that. Give you a minute to type something in. And if it's all of it, that's great. So hopefully it's some of it because that's why you're here. So you've already taken some board prep courses, but they're geared towards the old version. I got a new book. I'm looking to devise best study plans. Okay. And a study plan not to burn out. Yeah, that's good too. Yeah. Yeah. Because you can start now if you're taking it next year. But yeah, you don't want to burn out. And so we can talk about that. That's good. Okay. Well, if you others can go ahead and chime in the chat, but I'm gonna go ahead and get started. So, oh, I do see there's another chat. Critical reasoning and test taking strategies. Okay, awesome. All right, so content and format of the NPTE. I'm sure all of you know that the exam has changed. It changed in 2024, so everybody who took it in January had the new version of the exam. It will remain the same for the next 3 years until they, no, it's actually more than 3 years. I think it's 5 years. And then they look at, should we make changes again? So I'll go through this really quickly because probably a lot of you know this, but please stop me if I'm going too fast. So yeah, it's 24 through, oh, it does say 27. Maybe it is 3 years. I can't remember. But anyway, for all of you, it's probably going to be what you're going to be dealing with. So instead of 250 questions, now there's 225. You still have 5 hours to take it. So the time didn't change, but they decreased the number of the questions. The reason they did that was because they've added video clips and scenarios. And so they figure with scenarios, especially, it's going to take people more time. And so they kept it at 5 hours, but they took off 25 questions. Only 180 are being scored. So there's 45 questions on the NPTE that you're not being scored on. They're used to see if they're good questions to include in future exams. Now, you won't know which ones those are. If you did, you would just skip them, right? So even if you're reading a question, you're like, oh, I don't think this is a good question. Maybe this is a test item. Maybe this doesn't count. Assume it does, right? Answer every question to the best of your ability. The way the exam is formatted is 45 questions come up. You can mark questions for review. You can go back to a previous question. You can go to the next question. You can move around in that set of 45 questions. But at some point, you have to lock those 45 questions in. And then you go to the next set of 45 questions. Okay. And then the next set and the next set. So there's 5 sections of 45 questions. So what I tell people, if you're a fast test taker, you don't have to worry about this. But if you're a slow test taker, you want to make sure that you're getting 45 questions per hour done. If you do the first set of 45 questions and it took you more than an hour, you do want to kind of speed up a little bit, because if you continue to take more than an hour per section, the last set of questions, you won't have enough time. Okay. Most people, though, have enough time. Most people have enough time. All right, you do get a 15-minute break after the second set of 45 questions. So after question 90, there's a 15-minute scheduled break. We tell people, take it. It's the only time your computer clock stops, take it. And we suggest people get up, go out, go to the restroom, get something to eat and drink out of their locker, walk around a little bit, wake yourself up, come back, because now you have 3 more sets of 45 questions. Okay, the scenarios. So up to 40 questions will be scenario-based questions. Not 40 scenarios, 40 questions. So every scenario is supposed to have 2 to 5 questions associated with it. And it says up to 40, so you could have less than that, okay? But up to 40 questions will be scenario-based. What new content has been added to the 2024? Impact of regenerative medicine on PT prognosis and treatment related to MSK and neuro. So I recently asked somebody, like, what is it? What is this? And we have updated our therapy ed book for the new therapy ed book to include some of this. But somebody who does MSK said, oh, this is like using what is it? The stem cells and things. And so I don't know exactly what they're going to ask you about this. This is kind of new territory for me too. But we have updated the book to include that in the neuro and MSK. Telehealth, they've included. It's not state laws and rules related to telehealth. It's just the principles of telehealth. Interpretation of electrodiagnostic test summaries. So that's like if you get results of a nerve conduction velocity test, do you know what those summary results mean? This one blows my mind. They have added gross motor development progression. And I'm like, wait a minute. Wasn't that always on the test? Like, I am a peds therapist. I've always taught the developmental sequence. I've always told people, this is on the test. Make sure you know your developmental sequence. So them saying they've added it, I'm like, okay. I thought it was already there. They added negative pressure wound therapy and vacuum assisted closure as well. What did they take off? They took off phonophoresis. Okay. I guess that's okay, but they didn't take off much. The videos, I can't tell you how many videos you'll have. We don't know. We don't know how many questions you'll have with photos, pictures. We don't know. They don't tell us. But you are going to have some videos. The videos can be replayed. What they suggest is when you get to a video question that you go down to the bottom right of that video and hit the loop button. So the video will play over and over and over again as you're reading the question and you're reading the answers and you're trying to figure out. So you don't have to keep hitting play, okay? The videos can be slowed down and they can be paused. They're saying right now, on average, they're about 9 seconds. And you do not need sound. It's all visual. The content outline changed very little. So musculoskeletal used to be 28%, now it's 27.2. Neuro used to be 25, now it's 24.5. So it hasn't changed a lot. Cardiopulm used to be 13, lymphatics used to be 3. So it's pretty similar to what it was before. Knowing the content outline helps you with your study plan. If you know that neuro and musculoskeletal together is over 50% of your exam, I don't know that I would leave all that to the end, okay? If my weakness is musculoskeletal, I'm going to put that at the beginning of my study plan. If neuro is my strength, I'm going to put it towards the bottom. Maybe I'm not going to put it at the very bottom. I'm going to put it towards the bottom, okay? But you definitely want to make sure you get through those 2 big sections. We're going to talk about what other systems and such is. So I'm going to keep going. Okay, this hasn't changed that much either. So examination is 24.5%. That is your test and measures, your review of systems, your chart review, your normal joint biomechanics, your normal gait, your outcome measures. That's all examination. Anything that you would do, right, in your exam, subjective and objective exam would fall into that. But look at the biggest percent. 32% is evaluation, differential diagnosis, and prognosis. Why? Because you're becoming doctors of physical therapy in direct access environments. So they want to make sure that you can do these things, right? You know what differential diagnosis is. You know what prognosis is. Well, when you're thinking about prognosis, and you're reading different pathologies, always be thinking to yourself, what's the normal course of this pathology? Is it progressive? Is it not? What would I expect? Okay. Evaluation confuses people. So if I give you a question and say, okay, which of the following outcome tools would be best to use with somebody with this particular patient for balance? And you say the Berg. Okay. So you read the little scenario and you chose the Berg. That's an exam question. You were able to pick the appropriate examination question answer. But if I said to you, okay, you did the Berg and they scored a 40, what are you going to do? That's evaluation. Evaluation is, do you understand what the results of your test and measures mean? Okay. So whenever you're studying your exam stuff, be thinking, well, what would a positive on this special test mean? What other special tests might I have to do to, what is the result of this outcome tool? What does that mean? Intervention is almost 30%, so it's still big. Those questions can be difficult because sometimes you're going to read a question, you're going to read all 4 answers, and you're going to say, I would do all 4 of those things with this patient. Shoot, which one do I pick? You got to go back to the question. It's going to say, what's the first thing you're going to do? Or what do you want to do right before discharge? Or what's the best thing or the most effective? Okay, and then that makes one of them the right answer. Equipment, devices, technologies, modalities is 6%. Safety professional roles, responsibilities, evidence-based practices, 8%. So, you can just see from here, musculoskeletal, you're going to have about 49 questions, about 16 in exam, 16 in differential diagnosis, 17 in intervention. Well, look at lymphatics. You're only going to have like 1 in exam, 2 in differential diagnosis, and maybe 3 in intervention. So again, real important when you're setting up your study plan, you don't want, I had a student of mine, because I have all my students write study plans, and I review them. And I had one student say, well, I'm going to study musculoskeletal for a week. I'm going to do neuro for a week. I'm going to do cardiopulm for a week. I'm going to do lymphatics for a week. I'm like, oh no. Why would you study lymphatics for a week for 6 questions? You're going to do musculoskeletal for 2 or 3 weeks, and maybe you'll spend 1 day on lymphatics. Okay. So your study plan should reflect the content outline. About 28% of your study plan should be musculoskeletal. About 3% of your study plan should be lymphatics. Okay. Other systems. So I told you in that big pie chart that I would tell you what other systems were because I knew they were coming up here. So this is integumentary, metabolic and endocrine, GI, GU, and systems interactions. Okay. So 9 integumentary. It is bigger than lymphatics. Okay. Metabolic and endocrine. Can you see there are no PT examination questions. They are all evaluation, differential diagnosis, prognosis, or intervention. I can tell you the thing you want to focus on the most is diabetes. GI and GU, that's just about as big as integumentary. Why? Well, there's a lot of our patients come in with a lot of GI issues like GERD and things like that. Some of those pathologies can mimic MSK issues, and we have to recognize, wait a minute, this isn't musculoskeletal, this is something else. GU, we do a lot of pelvic health these days, so they want to make sure that you have an entry-level knowledge about pelvic health. Systems interactions, look at that. No exam questions, no intervention questions. These are all evaluation, differential diagnosis, and prognosis. So what is systems interaction? And it is 9 questions. So it's just as big as integumentary and GI and GU. Systems interactions is any pathology, condition, intervention that affects multiple systems. All right, so what's a pathology that affects multiple systems? Diabetes, GERD, a condition that affects multiple systems, obesity, depression. What's an intervention that affects multiple systems? Aquatics. This is where you're going to find your questions related to psychologic and psychiatric conditions. It's going to be where you find the questions about pregnancy, they're all going to be here. If you buy our big book, we have a whole chapter on systems interactions, and we make sure that we go through that information. Devices, you're going to have about 6 questions in devices. How long could you spend on just prosthetics? A long time, but there's only 6 questions. That is the beauty of the review books, because we hone in on the things that we think you need to know and things that are entry-level knowledge, so that you don't go down the rabbit hole of studying the fancy-dancy, really expensive power wheelchairs. That is not going to be on the exam, okay? And so, yes, you want to study this and you want to study modalities, but you don't want to spend a huge amount of time here. Modality questions has decreased. You're only going to have 4 to 6 questions now. Before it was like 6 to 8. So not a huge difference, but it did decrease. Safety and protection, about 6 questions. Those are going to be things like, do you know your universal precautions? Do you understand different lines and tubes? Do you understand your body mechanics for you and the patient? They say CPR and choking is on the exam. Professional roles and responsibilities, about 4 questions. So do you know what your role as a PT is? Do you know what's your scope of practice? What is not your scope of practice? Again, it's not state laws and rules, but it's, okay, do you know you should not give advice about medications? And a lot of these questions are the difference between a PT and a PTA. And then research, only 3 to 5 questions. A lot of students say, oh, I really need to put a lot of time in there. I'm really weak with research. And I'm like, okay, put in time, but not a lot of time. For 3 to 5 questions, I want you to study it, but I don't want you to spend a lot of time on it. Okay. Okay, just other things about format of the NPTE questions. All questions have 4 answers. They won't have 3, they won't have 5. They do not use all of the above, none of the above, A and C. They don't do any of that. They're going to be 4 discrete answers. They will all be plausible. So I had somebody who said, well, I've never heard of that special test before. I thought they made it up. No, they won't make up anything that doesn't really exist. It could be that it's not entry-level knowledge, and that's why you didn't know it, and it probably is the wrong answer, but they won't make up the hokey pokey test unless there's a really hokey pokey test. They will bold and capitalize keywords, best, first, most appropriate. But of course, they're not going to bold and capitalize all your keywords. There is a cross-out feature. You can cross out an answer that you know is wrong. There's a highlighting feature so that you can highlight keywords to make sure you don't miss them. And I think that's really important when you mark a question for review and you want to go back and review it, to make sure that you don't miss them when you go back to review, to have those highlighted. They use minimal abbreviations. They don't want to confuse you. They want you to understand. If you want to know what the abbreviations are, there's 50. If you search online the NPTE Candidate Handbook, you can download it or you can review it online, and there's a list of the abbreviations in there. I always suggest students look at that, but usually they look at it and they go, oh yeah, I know all these. And so that's fine. They don't even abbreviate PT and patient, because the people could get confused on that. Now, for standalone multiple choice questions, it is very important that you read every word in the question, because every word in the question is there for a reason. They are not supposed to add an age, a gender, an ethnicity, a setting, a time frame, unless it matters. So you really want to, if you're reading one of those standalone multiple choice questions and they give you, they say a 45-year-old female. 45-year-old, there's a reason they put that there. Female, there's a reason they put that there. You need to pay attention. The difference here is in the scenarios, you will be given extraneous information that may not matter to the answer. That is one of the reasons they put scenarios in. They want some questions where you have to decide what's the relevant and irrelevant information in the question. Okay. So you still want to read it all, but don't get hooked up on the fact that they gave you an age, a setting, a gender, because it may or may not have anything to do with the question. There's also different levels of complexity. They discourage item writers from doing straight knowledge questions where you just spit back the facts. I always tell students, very unlikely you're going to see a question about what's the origin and insertion of this muscle, right? Very unlikely. They want item writers to write more application. Well, if I understand where the hamstrings attach, then can I apply that information to answer this question? So you still may need to know your anatomy, but it's not going to be more spit back the knowledge. It's going to be, can I apply that information? The highest level they have are called synthesis analysis questions. This is where you have to know multiple pieces of information to figure out how to put them together to answer the question. I highly recommend that if you have not done this, that you take this NPTE sample mini exam. There is one for PTA and PT. I tell people to take them both. Why not? It's a practice. Both of these mini exams have video questions and they have scenario questions as well. I like people to go in and look at the scenario questions because it's formatted exactly how it's going to be on the exam. So the scenario comes up, you can minimize the scenario, get to the question, and then if you need to go back to the scenario, you can blow it up again. So I think that's just nice to see before actual test day. They also give you the same tutorial on how to manage the exam as you will have on the test day. So I think it's just good to do ahead of time when you're able to think clearer and get all that information in. Then on test day, you can go through the tutorial again. The time hasn't started. Your exam hasn't officially started, but you don't have to worry so much because you've already read it, okay? And it just talks to you about like, how do you cross out answers? How do you mark stuff for review? That kind of stuff. Now, when you take these mini exams, people always want to know, did I get it right? So on the home page, it tells you the answers. And so you can check to see if you got them right or not. All right. Any questions about that? You can put something in chat or unmute. Any questions about the format change? All right. I'll make sure we have time at the end for questions as well. All right. Let's look at study plan. We recommend that you start your formal study plan about 8 to 6 weeks, depending on time available. So if you're going to graduate in May and you're going to take the exam in July, and you really aren't doing anything between graduation and the exam, you could do 8 weeks. That would be easy. If you are studying right now and you're taking the exam in April and you're on a clinical, you tend to need more time because you usually can't study Monday through Friday, or you can do only very little. So you're going to need more time. Okay, so probably usually about a 12-week plan. Make your list of priorities. What are your strengths? What are your weaknesses? Start with your weaknesses. We don't want to do that. We want to study the stuff we know, the stuff we like. Don't do that. What happens if you run out of time and you left your weaknesses to the end? You don't want to do that. What if you burn out? And you burn out and you just can't study anymore. I can't do this anymore. And you didn't get to your weaknesses. You don't want to do that. Plus, in your study plan should be a day where you're always reviewing. Well, if you start with your weaknesses and every week you're reviewing them, by the time the exam comes, they're like your strengths. Okay, so you need that repetition. So make sure you start with your weak areas. And incorporate knowledge checks. Okay, I'm going to study musculoskeletal. I've finished musculoskeletal. My 2 weeks are done. I'm going to start neuro. Wait a minute, maybe I'm going to check to see how I did with musculoskeletal. You know, can you, if you have our app, you can go on and say, okay, give me 25 questions of nothing but musculoskeletal. Okay, maybe you decide this is the point where you want to take a full practice exam. Do that, but really hone in on how'd you do on musculoskeletal. Okay, so have those knowledge checks throughout. We do suggest you do 3 to 4 full practice exams. Is your program buying you exams? If they're buying you the 2 Pete's, the academic Pete's, you have 2. Where are you going to get the other 2? You can use ours, buy our big book, you get 3 exams with it. You can buy 2 student Pete's if you'd like, okay? But you should have 3 to 4 full practice exams. Again, have a weekly session where you're reviewing what you've already studied. It gets it in that brain. I highly recommend group studying. I think I'm going to talk about that here in a little bit. But it's just very, very valuable to study with a group. If you do not have a group, please come on to online office hours. I think a lot of people have already heard this session, so maybe that's why a lot of people didn't come on tonight. We'll probably see more and more people in the next couple of weeks. You can always put into the chat, hey, anybody need a study buddy? Because I don't have anybody to study with, okay? And you might be able to find that. Should practice tests count as study time? I don't recommend that. I think you are studying, especially when you review the practice exam. But we recommend, and I think I'm going to get to this, we recommend 108 hours of studying, and I don't include the practice exams in that 108 hours. So we'll get that in a minute. You do want to make sure you get to all content areas. So, like I said, research is only 3 to 5 questions. Lymphatics is only 6. But here's the thing. Some people fail by a very small amount or pass by a very small amount. So we do want you to get to all content areas. We want you to complete those review books. We want you to make the plan yours. I think I'm going to share with you my study plan. You can take my study plan and just run with it, but it doesn't fit everybody. Okay. And so I recommend that you look at it and say, okay, I like parts of this. I don't like this part. I need to add more time here. I want to move musculoskeletal to the end. I mean, you can do that. I allow my students to collaborate. So I'm like, okay, if you 3 are forming a study group, write your study plan together. Follow the same plan. That way it's easier for you to study, but you have to take everybody's strengths and weaknesses into consideration when you're writing that study plan. Okay. We have found from surveying students over the years that the average student who has passed tells us they studied 3 hours a day, 6 days a week for 6 weeks. Well, that doesn't work for everybody. So I just did the math. That's 108 hours. So we say, okay, if the average student needs 108 hours to study to pass, then your study plan should have at least 108 hours. And again, it's not including the practice exams or the time you're spending in reviewing your practice exams. Study by topic before you move on. I would not be able to study musculoskeletal for 2 weeks. It's not my thing. I don't like it, but I could study the knee. I could finish it, and then maybe I'm going to go on to GI. And then I'm going to come back and do the shoulder, and then I'm going to go to integumentary. Like I might have to break it up that way, but however you break it up and whatever you're studying, finish it. You don't want to start studying wound care dressings and not finish it and move on, and then start studying primitive reflexes, but don't finish and then move on. That will build your anxiety. You'll feel like you've never completed anything. And so you don't want to do that. Integrate your sources. Use review books, use your textbooks, use your classmates, use your faculty, use us. That's what we're here for. Some students just want to take practice exams. Oh, I'm going to take practice exam after practice, and they're taking 10, 12 practice exams. That's not the best thing to study. Practice exams are great to see where you are. Are you getting better? It helps you understand the things you need to key in with on the exam, but it's going to be mishmashy. You're not really going to be, every exam is a little different. And so you're really not going to get thorough studying done. So don't use them to study. When you go to take a practice test, sit for 5 hours. Simulate the environment of the NPTE. Only take that 15-minute break after question 90. Some students really need to work on the endurance to sit there for 5 hours. When you review your practice exams, of course you want to review the questions you got wrong. Clearly, start there. But I tell people also review the answers you got right. Why? Maybe you got it right, but your thinking was different than the rationale. Okay, so you're going to learn, or maybe there was more to it. Or maybe you were guessing and you got it right, and you didn't know the rationale. So when you read the right answers, and that's a great way to group study, is say, hey, let's all take the same exam. And we'll get together in Starbucks this weekend and let's go through the questions we got wrong, and then we'll start going through some of the questions we got right. But if you do that, you were guessing, you got it right, you review the rationale. Now, when you take another practice exam or the NPTE and that content comes up, you're gonna have a lot more confidence in answering it, because you know you're not guessing anymore, you know. Okay. So the 6-week plan, this is Therapy Ed's plan. They say, okay, if you're gonna do 6 weeks, start with a weak area or a large content area for a week and a half, take a practice exam, go to another weak area or large area, take another practice exam. You know, and after you take every practice exam, you should be thinking, how am I doing? Should I tweak my study plan, or am I on track? Is this working for me? They say continue for another week, take your third, you have one more week, take your fourth, make plans for final studying, and then you'll have 5 to 7 days left to kind of do some final studying. Does reviewing the exam after counting is study time? You could. I don't count it in my study plan, but I mean, that's up to you. So, but let me show you mine. So I struggled with the 6-week plan. So here's my plan. So basically, 28% of this is musculoskeletal, 25 is neuro, 3% lymphatics. So the hours in here are based on the content outline, but it's also based on 108 hours. I have 4 practice exams in here and a day for you to review your exam results. I did not include that in the 108 hours. Okay. But you could, I mean, I guess it's just, you know, see how things go. On Saturday, I have a review. So I want to show you this. Let's go to week 4. Okay, here's my review. So week 4, I'm reviewing all the musculoskeletal, all the neuro, and the 2 days of cardiopulm that I did. Okay, so these reviews are actually building because you're reviewing the stuff you've already studied. Okay, so in reality, the first week, an hour might be fine. The second week, an hour might be fine. But week 3 and week 4, you may actually have to make that 2 hours. Week 5 and 6 might have to be 3 hours. So those might have to build a little bit. Okay. So here's the thing. Before you sit down to study, you need to think about, how am I going to go about this? Right? You can break up musculoskeletal into body parts. I did it based on the pages in our course manual and our study guide. So I broke up the pages so that, you know, if I do these many pages every night, I can get through musculoskeletal in the big book, in the 2 books by, you know, this 9th day or whatever. Okay. But you also have to think about, well, what am I going to review on Saturday? We do not recommend you reread the book, which is good news, right? I don't like to read. I struggle. So reading and rereading the book does not help learning. You do not want to do that. You want to read the book once. My suggestion is, as you read the chapter on musculoskeletal, highlight the things that you want somebody to quiz you on. Okay, I forgot that this is, you know, the biceps reflex is C5 and C6. I'm going to highlight that. Okay, somebody can quiz me on that. Okay. The things when you're reviewing that you're like, okay, I'm struggling with this. Like, it's not that I'm not going to remember it. Like, I'm struggling to understand it. Those are the things you pull out and put on a study guide. Those are the things that you talk to your group about. Those are the things you may have to look up more information about. But a lot of students do study guides, and what they end up doing is rewriting the whole review book. That's a waste of time. Do not do that. Okay. So on Saturday, when you're going to study, hand somebody the book. Quiz me on all the stuff in the musculoskeletal chapter that's highlighted. Here's my study guides. Quiz me on those. Okay. So that's what I would suggest. If you're on clinical and you're going to be studying, you may have to draw it out to 12 weeks. And so now most of your studying is going to be on the weekend. Do develop a study plan. You can do it quickly. Use a calendar, an Excel spreadsheet, whatever. If you don't have a study plan, you are going to feel like you don't know what you're doing. So we had, I had a student about 2 years ago reach out to me. She said, I did not pass the NPTE. And I said, oh, I'm so sorry. I said, what do you think happened? She said, I spent so much time studying musculoskeletal that I quickly hurried through cardiopulm, and that's all I got to. I'm like, did you have a study plan? No. Okay. We're going to have a study plan. You need to follow it. At some point, you need to move on because you need to get through everything. Okay. So get a calendar, mark off the days you can't study or the times you can't. Figure out what are the best days for those practice exams where you're going to need 4 or 5 hours. Schedule time to review those exams. When am I going to do my group studying? Okay. Fit that in. Can you fit in 108 hours in that 6 weeks or 8 weeks? If not, you got to move your start date back. Questions about study plan? You can keep asking, but I'm going to go to some of this we already kind of talked about. So, what's your goal for the session? Okay, I'm going to study wound care dressings tonight. I'm going to study knee special tests, whatever it's going to be. Know your goal. Use the review book. That way you stick to entry level. Again, constant quizzing, asking yourself questions, having somebody else quiz you. It's what's going to help you. And again, we already talked about this. Highlight stuff in your book. Develop study guides or flashcards. Don't rewrite the book. Make sure you get to all types of critical reasoning. So analytical questions on the exam are going to be, okay, your patient presents with this, 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 and this. What do you think's going on? They're the signs and symptoms. And so what I tell people is you have to study those pieces of the puzzle or those signs and symptoms. So I'm going to give you an example. I had a student of mine who came to me and said, Suzanne, all the cardiac pathologies sound the same. And I'm like, okay. She's like, I can't answer these questions when they come up. And they give me these lab values and signs and symptoms and ECGs. I don't know. They all sound the same. I said, okay, you're going to make a table. Here's all the common cardiac pathologies that we see as PTs. Next column is going to be signs and symptoms, lab values, ECGs. Make a table. Study the pieces of the puzzle, compare and contrast. Then when these questions come up, you're going to have the answer. That could be neuropathologies for you. It could be a difference between venous and arterial insufficiency, but you need to be able to differentiate those things. Inductive and deductive things, I'm just going to put both of those. Those are opposites. Inductive is when you know something very specific, and you have to apply it in a general sense. So let's say that you learned a very specific PNF technique and special technique and pattern for somebody who's had a stroke with a hemiplegic shoulder. Okay, that's very specific. But if you're good with inductive reasoning, you're able to say, okay, yeah, I can see how I would do that PNF technique with that patient. But you know what else? That PNF technique would also be good for this patient and this patient and this patient. Okay, so whenever you're studying something and it's very specific, you should stop and ask yourself, well, who else would I use this examination test with? Who else would this intervention benefit? Who else presents in this manner? Okay, that gets you to thinking in an inductive way. Deductive is when you know something really general. Let's say you learn the general concepts of aquatics. Great. Okay, I get aquatics. I understand. Okay, but you know what patient would be perfect for aquatics? Okay, so you're going from general knowledge to the specific patient that it would be perfect for. So inductive and deductive are opposites. So my point here is when you're studying, ask yourself or your group, who else would we do this with? Who would we not? Why? Where would this be applicable? Who else presents in this manner? Those types of questions. Inferential questions are hard. These are the questions when you're on the exam and you read a question. Patients had a traumatic brain injury, blah, 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 blah. And you're like, well, I need more information. How bad is this brain injury? When was it? What's their Rancho level? Okay, the question's not giving you that. So what they want you to do is just think about, what does somebody typically with a brain injury look like? How do they typically present? And based on your knowledge, can you make an educated guess or predict what is the best thing? So those questions are hard. So what I tell students is always be thinking about, how does the typical patient present? Okay. Evaluative, I think a lot of people do real well on these. These are ethical decision-making questions. They're the, it depends. Well, why does it depend? Those are those types of questions. So always be asking yourself that. Like, why would I do that? Not this. It depends. Well, why? Okay. Group setting is very valuable. Groups have more knowledge than one. Groups stimulate creativity, problem solving. Students retain more information from group studying. They come away with a deeper knowledge base. They feel overall satisfaction and supported. So I do highly recommend group studying. Several years ago, a student was on her last attempt at the NPTE. You only get 6 attempts. She was on her last attempt. And I said, who are you studying with? No, I don't like group studying. I don't group study. Okay. Did you group study in PT school? No. How did you do? I struggled. Okay. You're going to group study. And I found a group of my students who took her in. She group studied with them. She passed the licensure exam and she emailed me and she said, that was really great. I wish I'd had a good study group in school. They do say the ideal size is 3 to 5. So if you only have one other person to study with, that's what you have. But if you can find a third person, that's great. If you have 6 people, don't vote somebody off the island. But if the group gets too big, it's not going to be effective. A lot of people don't like to group study because they say it increases their anxiety. So how do you manage that? Decide what you're going to study. When we get to Starbucks on Saturday, we are going to study stroke. Okay. Study it by yourself first. And then when you get there, you're going to feel pretty good because you're going to know the information. And it's actually going to help your anxiety. If you study it first and you go in and then through the conversation, you feel confident you know it. If you don't have a good study group, find another one. The other reason a lot of people don't group study is because my group doesn't stay on task. So some of you have heard of this technique. You pick a task. Okay, we're going to study wound care dressings for the next 25 minutes. You set a timer. You stay on task. When the timer goes off, okay, now we have 5 or 10 minutes. Let's go get coffee. Let's go to the restroom. Let's talk about the movie we're going to see. But as soon as that 5-10 minute timer goes off, we're back to another 25 minutes. Now we're going to study, stages of lymphedema. Okay, that will help stay on task. All right, test taking tips. Read the stem of the question very well. Missing one word could change the meaning of the question. What is the item writer asking you? Sounds simple, but have you ever read a question and you get down into the answers and you're like, oh, I can't figure this out, You go back to the question and you're like, oh my gosh, it asked me which of the following is least likely. I totally missed that, right? So a lot of students tell me what they do is they read the stem of the question, they read the answers, they pick an answer, they reread the question. and then verify their answer. And that's what I would suggest that you do with every question. Remember keywords, use that highlighting feature. Read all the choices. Don't pick the first one that just looks good. Most people get it down to 2. Most people are like, I get it down to 2 and I don't pick the right one. Okay. So you're just going to have to look like, why aren't you picking the right one? What are you missing in the question? What did you not understand? But don't give up on a question. Don't be like, oh, I don't know what this is. I'm just going to pick from 4, right? Use some test taking tips to try and get it down to 2. It's very likely one of those is the right answer. So now you only have a 50-50 chance of getting it right. If you know the answer is wrong, cross it out. Then you don't even have to look at it again. Okay, we talked about this. Reread, verify your answer, mark it for review. Okay, if you have time, we do suggest you go back and review. If you don't have time, you're going to have to move on. But if you have the time and you've marked some for review, go back and review them. Remember, on the NPTE, your priority is the safety of the patient. That is first and foremost. Okay, think about what is physiologically best for their body. That is your priority, okay? Because the mission of the FSBPT is to make sure you're going to be safe. So if there's an answer that's a more emotional thing, a more social thing, financial thing, that is secondary, okay? Even function. There's a question in our review, our 2-day review course, and one of the answers is to teach the child how to use utensils to eat. But the whole question is they're struggling to get food in the child. And I'm like, wait a minute. The function, yeah, I want them to learn how to use utensils. That's function. That's great. But you know what? I need to pick the answer that helps me get the food in the child because that's what's best physiologically for their body. So I need to go to that answer. Don't add extraneous information. Are you this person? Well, maybe they have steps at home. Well, you know what? Maybe they don't. Maybe they live alone. Well, maybe they don't. So if you do that, catch yourself. If you start doing that questioning, say to yourself, could the opposite be equally true? Yeah. Okay, get it out. Take it out. You're just going to mess yourself up by putting that information in. Okay. Now, inferential reasoning, though, is different. If I say, this patient is coming to see you for intervention and they have multiple sclerosis, and you know that these patients, their biggest complaint is typically fatigue, you can make the inferential reasoning that probably they need energy conservation techniques. Okay. Do you see the difference? Maybe they have steps at home. Maybe they don't. That's adding extraneous information. But when they tell you the person has MS and you know that their biggest concern is fatigue, you can make that leap that, oh, they probably have fatigue. I need to consider that. Okay, that's different. Okay. Hopefully I'm making sense there. Mark questions for review. Review if time allows. If you still don't know, do not change your answer. Do not just second guess yourself. And students, I think, somewhat learn not to do this, but do not do that. But if you go back and the light bulb goes on, oh my gosh, I misread that. Oh, I get it now. Oh, I missed that keyword. Oh, it says least likely. Then change your answer. Okay. Now, some students say to me, I don't do that at all. I don't check questions for review. I do not go back and review. And I'm like, well, that's not a good strategy either, because research tells us that if you actually use the light bulb strategy, you will actually change the wrong answer to the right answer by approximately 3 to 1. They have actually done research on this. Could you believe it? They have. Not with PT students, but nursing, dental, medical students, and they have found that you should go back and review. Don't know, leave it alone. Light bulb goes on, change it. And you will change probably more from the wrong to the right than the opposite. Slow test taker. Again, it's now 225, so it used to be 250. 225 questions, 45 questions per hour. That means 1:30 per question on average. I don't recommend you use the highlighting feature on every question. It will slow you down. You need to take practice tests. You need to work on your timing. And get it to that point where you know what a 1:30 feels like, and you're able to get through those 45 questions in an hour. Fast test taker, is that a problem? Maybe, maybe not, right? If you are a fast test taker, but you're passing your practice exams, probably not a problem. If you take an exam and you go back and you check the answers or the questions you got wrong, and you say to yourself, oh man, why did I do that? Oh, that was a silly mistake. Oh my gosh, I didn't see that. You're going too fast. That's the cue to you that you have to slow down. How do you slow down? Use the highlighting feature on every question. It forces you to slow down because you have to read every word because you're deciding which ones to highlight. All right. Again, yes, you want to review the questions you got wrong, but review all the questions when you can. But also ask yourself, why did I miss this question? Is it because you didn't know the information? Okay, write it down, look it up. Did you not understand it? Get someone to explain it to you. Or did you understand it, but there was something in the question you missed? Oh, I understood that, but I didn't see they were a teenager. Or I didn't see they were in home care. Okay, so what did you miss in the question that didn't have you apply it right? Did you just miss keywords? Oh, I missed the age. I didn't even see it. Okay, I'm skipping relevant information. You need to slow down. Are you just second guessing yourself and changing your answers? Okay, stick to that light bulb principle. Did you add? Well, maybe they have stairs at home. Okay, well, you messed yourself up doing that. Okay. So you do increase your knowledge by reviewing questions. So it is valuable to do that. Okay. Also, I find that I make my students take I make my students take 4 comp exams. 4 comp exams. I know I'm mean. And I have some students that during that fall semester, they don't study at all. But what happens is typically their scores start to go up just because they're getting used to the questions. They're getting used to how to take it. They're getting used to sitting there for 5 hours. They're applying the light bulb principle to when they go back and review. So just naturally, people's scores start to go up. But focus on, what did I study? Okay, I've studied musculoskeletal and neuro. Are my results going up in musculoskeletal and neuro? I'm not going to worry so much about other systems yet because I haven't studied it yet. Okay, so don't get hooked on what you're not passing yet, but you haven't even studied yet. Okay. But it'll help you as you take practice exams. Do you need to adapt your study plan? Do you need to change how you're studying? Do you need to change test taking strategies? But you want to see, is your total score going up? And the things you studied, are those scores going up? That's what you want to look for. I highly recommend that you log your scores on an Excel spreadsheet or on a table. I would put the date, the exam you took, your overall score, and then I would list all your scores. This is how I did in musculoskeletal. This is how I did in differential diagnosis. I would log them all. Because what happens is students get a hold of me and they say, okay, I'm freaking out. The NPTE is 3 weeks away. I finished my study plan. Or, I'm almost finished, but I'm freaking out. Am I ready? And I'll say, I got to see your practice exams. And I ask them to lay them all out. Or if somebody doesn't pass the NPTE, get your results. Let me look at all your results. Okay. There's usually patterns. You don't see them. Like when you're reviewing one exam after another, you don't see the pattern. But I'll look at it and say, wait a minute. This one you've passed all the time. This one you never passed. This one you passed 2 out of 4 times. This one you passed 1 out of 4 times. And this one has higher scores than this one. There is a pattern. And so students are always welcome to email me their results and we can talk about it. What is passing? Well, 70 to 75% if you're taking practice exams. Therapy eds exams, I'm going to tell you, are difficult. We are trying to over prepare you. So if you don't hit that 70, I tell people that's okay. All right. If you're taking the PEAT exams, you should be striving for the 600. Okay. Do not look at percents. So a lot of students, when they get their PEAT results back, just look at the percents and don't look at the scaled score. You have to look at the scaled score. So I'm going to give you this example. I had a student once who said, okay, I did a clinical, pelvic health clinical. I thought I knew GI and GU. I even studied it. And look, I took the PEAT and I didn't pass. I got a 62%. And I looked at it and I said, you got a 609, you did pass it. So the percents just tell me or you how easy or difficult that set of questions were. Okay. It doesn't tell you if you passed or not. The only thing that tells you if you passed or not is the scaled score. It has to be 600 or higher. Okay. I've also seen the opposite. I've seen somebody get like a 78% on a section and they got a 590. So they thought they passed it and they didn't, because those were really easy questions. They didn't get enough to get the 600. Okay. Each exam is different. So that's why we recommend you don't study from that. Oh, this is an example. This is a student of mine. So yeah, what I did was she logged all her results and then I highlighted in green what she was passing. Yellow was what she almost passed. Blue is the lowest scores. So you can see cardiopulmonary twice, that was her lowest score. So I'm like, you need to start here. Interventions, you rock interventions. You don't need to spend a lot of time there. And so you can start to see these patterns. All right, I know we're getting close to 8 o'clock, so I'm gonna get through this and then definitely want to save time, or I will stay on. I don't think I saved time. Definitely I will stay on for questions. Prior to the exam, trying to manage anxiety, complete your study plan. If you can complete your study plan, that's going to help your anxiety. I want you to go to the test that day and say, I did it. I made it through those review books. I finished my study plan. I took those practice exams. I am ready. That will help your anxiety. Seek help on campus. If you struggle with test anxiety, get help right now. Drive to the Prometric Center like a couple weeks ahead. Like if you don't know where you're going, you don't want to get lost that day. I tell people, park, walk in. Say, hey, I'm taking a test here in a couple weeks. I just want to see where the lockers were in the bathrooms and just want to talk to you a little bit. Believe it or not, the day of the exam, your anxiety will be less because you know where you're going and you know what your surroundings will be. Always focus on what you've accomplished, not what you have left to do. Okay, I got all the way through that musculoskeletal chapter. Yay! Okay, I'm not going to focus on all the stuff I still have to go. I accomplished that. That's awesome. I'm going to move on now. Now I'm going to study that neuro stuff. Managing anxieties, keep that positive attitude. Give yourself reminders if needed. That helps anxiety. Day of the exam, arrive early. You don't want to be late. They ask you to be there at least 45 minutes early. Understand there are things that are outside of your control and don't let those things upset you. If there's a delay, there's a computer glitch, you just have to say, okay, it's out of my control, and I'm really not going to get upset about that. Do that tutorial, that 5-minute tutorial before the exam begins. Do some deep breathing. Deep breathing works on our autonomic nervous system, decreases our heart rate. You will get 2 dry erase boards. Some people tell me you can't write anything down till the exam starts. But once the exam starts, you can write whatever you want down on those dry erase boards. So some people tell me if I do a little brain dump, that decreases my anxiety. I know when that question about sensitivity and specificity comes up, my answer is on my dry erase board. But 5 minutes tops. A student of mine took like 10 or 15 minutes doing that brain dump. And then she said, then I freaked out because I realized I was behind on the exam. Like, you don't want to do that. This happens a lot. you get into the exam, you calm down, you're taking the exam, then you get to several questions in a row that you're struggling with, and your anxiety starts back up again. Stop for a minute. Think to yourself, okay, yes, those few were difficult, but there were a bunch before I got right. Take a deep breath. I'm sure the next few will be okay. You really have to talk to yourself to manage that anxiety that starts to build. Watch your time. If you get behind, that will increase anxiety. All right, Therapy Ed resources. We do have a 2-day prep course, in person or online. We have a course manual, which is like a your outline, blueprint, cliff notes that come with that course. We do have our review and study guide, which is the big book for comprehensive studying. It has all been updated for 2024. With that review and study guide, you get 3 exams. Our exams are 225 questions with scenarios and videos. We've just updated them. We do have a new app. On the new app, it is cheaper right now. I think it's like $39 or $49. It will be going up to $100 at some point, but right now it is cheaper, and that is for you to do sets of questions. So you could say, okay, I finished integumentary. Let me do 10 questions today on integumentary, and you can do that on the app. And then we have the online office hours, right? So this is the first online office hour. We will be doing 8 more, and then the April test will come. We'll take a break, and then we'll start again. If you want to do all the topics we have, you'd have to attend 3 consecutive 9-week online office hours. But all of these are recorded on YouTube. And so even if there's one that you miss or whatever, you can go and look at those on YouTube. Do you need a score of 600 or higher on every subject to pass? No. You just need a total score of 600. You could completely fail miserably integumentary and lymphatics and research and still pass the exam. But when you are preparing for the exam and you're taking practice tests, your goal is to get a 600 on everything. Your goal is to pass everything. All right. Woo. Okay, what questions do you have? I hope I didn't go too fast. So much information to give you. I could even spend another hour. Questions that you have, anything you want to put in chat or unmute and ask. I didn't update this. Next week is primitive reflexes. I will be doing primitive reflexes. And the way I do online office hours is not the way I did it tonight. Tonight, I'm doing a lot of the talking. The online office hours, when I do them, there are questions, you answer it. We go over, why is this the right answer? Why is this the wrong answer? We go to the next question. Why is this the right answer? Why is this the wrong answer? Do a little teaching, go to the next question. So it's more interactive than tonight. There's my email though. So if you need anything after tonight, please don't hesitate to email me. And if you don't have any questions, then have a good evening. But I will stay on for a few minutes in case anybody does have questions.